The second bone for our revision today is the clavicle, one of two bones forming the shoulder girdle. The clavicle is a long bone as it has two ends and a shaft. The clavicle doesn't have a medullary cavity, and the common site of fracture is located between the medial 2/3 and lateral 1/3 of the clavicle. This is the weak spot, or what we call the common site of fracture of the clavicle. The clavicle has two ends, the medial rounded end and a lateral flat end. The shaft of the clavicle is curved twice. The medial 2/3 of the clavicle is convex anteriorly. The lateral 1/3 of the clavicle is convex posteriorly. The upper surface of the clavicle is a smooth surface, while the inferior surface of the clavicle is a rough surface containing a tuberosity for a ligament attached to the first rib, and a tubercle and a ridge for the attachment of the coracoclavicular ligament. This is what we call the conoid tubercle, and this is what we call the trapezoid ridge. In the middle, we have the subscapular fossa. The articulation of the clavicle. The clavicle articulates with the medial end with the sternum, forming the sternoclavicular joint, which is a saddle synovial. The lateral end of the clavicle articulates with the acromion process of the clavicle, of the scapula, forming the acromioclavicular joint, which is a plain synovial joint. As for the muscle attachments, the first muscle attached to the front of the shaft of the scapula, the front of the shaft of the clavicle on the medial 2/3, which is the clavicular head of the pectoralis major. On the lateral 1/3, the front of the lateral 1/3 of the shaft, we have the attachments of the anterior fibers of deltoid muscle. On the posterior aspect of the lateral 1/3 of the clavicle, we have the attachments of the trapezius muscle. On the medial aspect, we have the attachment or the origin of the sternocleidomastoid muscle. The final attachment is at the subclavian fossa, which is the subclavius muscle and the clavipectoral fascia, attached exactly in the middle. Thank you for watching the second part of the upper limb bones revision. Please subscribe.